Last May, Milwaukee's Office of Violence Prevention started working with local hospitals that treat gunshot victims to try and stop the cycle of violence.
Now, just a few months into the program, doctors are seeing results. Tom Durian gets a look inside the program.
There's a recurrent pattern that we're seeing, and this pattern is just excruciating to watch.
Dr. Mark DeMoya sees gun violence as a public health crisis, and not just the mass shootings across the country, but the dozens of cases of gunshot wounds he sees every year in the Froedtert Trauma Center.
How can we identify what we can do to actually intervene and start to break the cycle?
One way to do that is to get in the middle of the cycle. Of the 3,500 total patients the Froedtert Trauma Center sees, about 10% or 350 are gunshot wounds. So in collaboration with Milwaukee's Office of Violence Prevention, a violence interrupter from the 414 Life Team meets with shooting victims and their family members.
The objective is to keep our community safe. We all live here.
Tonia Liddell is one of the interrupters. She's on call and at the hospital at a moment's notice in an attempt to stop the cycle.
We're here in this situation right now. We don't want to have any other families or individuals end up in this place like you are right now.
If we can break that retaliation, piece, that's really starting to really get to that prevention piece.
There is one medical glimpse of hope in the middle of all this. The frequent treatment of gunshot wounds leads to the saving of more victims.
If you're shot, going to a high volume center that deals with gunshot wounds. If you've got cancer, going to a high-volume cancer center, I think improves outcomes.
Both the doctors at Froedtert and the violence preventers believe that their work is helping stop this cycle of violence, intervening in at least 60 cases so far. Reporting in the newsroom, Tom Durian, today's TMJ4.